So, welcome to the 15th Annual Forum. I'm Sarah Paget, and I'm the Programme Manager, and have been for quite some time, actually, and most of that 15 years, actually. I've been involved in Community of Communities to some extent. I can't help thinking, looking around, that there are so many TC giants in the room that I feel like I need to point them out to people who don't know who they are. But on the other hand, I'm also conscious that there are so many therapeutic communities represented here in terms of children's communities, learning disability, people working with those with a diagnosis of personality disorder. I don't know whether we have those people working with substance misuse and addiction. But for those of you who are working and who have read seminal works by people like Rex Haig, this is Rex Haig. He's sitting in the front seat here, and has probably written one of the most seminal papers in TC practice, The Quintessence of Therapeutic Environments. If you haven't read that, please do. Jan Lees is sitting next to him. She was responsible, along with David Kennard, for the original standards for therapeutic communities. So if you need to speak to anybody about, and blame anybody about the standards, it'll be Jan Lees down here. And of course, Steve Pearce, who is, leading the way in terms of providing therapeutic communities with an evidence base, which is some feat, I have to say, and it's something that I want to bang the drum about a bit today. If I've forgotten anybody else, I can see some other TC giants around, so if you want to know who they are, I'll point them out. So I just want to reiterate a little bit about what John said about some learning objectives. It's interesting, isn't it? We come to conferences, it's good to think about why we're coming. What is it we're coming there to learn? And to be honest, just coming here and having a bit of fun is a good enough reason. But when we were putting together the programme, we were thinking about what it is what are the three things we want people to go away with. And I think one of them is an understanding of the modern face of TC practice. I think there are a lot of changes that have gone on in TC practice over the last 15 years, some of which we are sad about, the changes that people have mentioned. But on the other hand, there are enormous positive stories across the network. And I think that they need to be celebrated along with us grieving for the past and past greatness. I think what Craig was alluding to some extent in relation and what the PET archive represents is the reality that during difficult times, therapeutic communities have come into existence. And if you think about the initial therapeutic communities, they came out of difficult times. And I have no doubt that we're going to hear that therapeutic communities are appearing in hospital wards here, there, and everywhere, or prison wings. And they don't know that they're therapeutic communities at this point, and it's up to us to reach out and identify them. And I never forget, there was one community, one children's community, that became part of the Community of Communities after having heard about us along the way. And then on their first peer review, they were astonished to find that they were a therapeutic community and that they'd suddenly found their home. It's like, well, my God, this is what we've been doing all along. And I think we'll find that there's a lot of those out there. And it's important to introduce them back to the fold, and so that they can learn from us. So also, of course, Community of Communities is a quality improvement network. It's about improving the quality of your care, of your service. And hopefully I'm going to demonstrate a little bit of how Community of Communities does that. And of course, the most important thing is about building relationship and sharing learning across the network. So we wrote an annual report last year, which most of you will have had, which looked a bit like this. You should have all received it. If you haven't, let us know. And in that report, we set out a number of action points for ourselves in relation to what you said and what we needed to think about. And the first one was to enable services to use patient-owned database. Some people, we call it POD, some people may have heard of it, some people haven't. But it is an outcome data tool that we are signed up with the Anna Freud Centre, which is available to members. And it's something that we want to encourage you to use because it will enable you to measure the effectiveness to some extent of the therapeutic community. And we said that we needed to help people use that. We also wanted to develop and implement Space House, which was an online tool to engage children, young children especially, in the community of communities process, that exists online but is not used as much as it could be. We wanted to train more peer and lead reviewers to encourage more learning opportunities. People were giving us feedback that perhaps they weren't learning as much on peer reviews as they'd like, or that peer reviews perhaps didn't allow as much shared learning as they'd like. And we felt that this was something to do with training peer reviewers, training lead reviewers, to enable both the review team to get a lot out of the visit and to get stuff out of the visit, and also for the host TC to gain out of that. We also said we would deliver workshops on the core standards, their importance in terms of the framework and developing a framework for your service. And also that we would deliver a workshop on how to get the most out of your membership of communities, so how to advertise your membership and to support the work that you do. So what we did was we held a training event around POD, circulated information about the value, and we currently have 5 services that are active members of POD, but we need more. And I really want to sort of give a big shout out for this at the moment, because with 5 services, it would be difficult for us to continue to deliver it. So we need to encourage you, if you're interested in collecting data around outcome measures, then give us a shout about that. It's free at the moment as part of your membership. It's a costly tool to use if you were to sign up independently. So I give you a shout to do that. So it's another thing we need to be doing. Space House has experienced a number of hiccups this year, but we are going to further develop it, and I'm in talks with the developer to do that. 39% of reviews were led by trained lead reviewers outside of the community of communities team. 61% of visits were delivered by trained lead reviewers. 51% of visits had trained peer reviewers, and this is quite a new process actually. We've not always trained peer reviewers. We've certainly trained lead reviewers, but we haven't trained all peer reviewers, and we're moving in that direction. Of course, the accreditation visits in particular, but we're moving towards that. And the training, please attend it. We do 2 trainings a year, and it's important because being a peer reviewer, you know, it's a critical element, not just in terms of accreditation, but also in terms of getting the most out of the day, both for you as a peer reviewer, but also as you're reviewing the host community. And we did develop a workshop aimed at core standards and improving the way in which you communicate your membership to commissioners, external stakeholders, and senior managers. So moving on to 2016-17, so this last year, which is the 15th annual cycle of Community of Communities, we had a total of 80 members, and they were spread across children. So we now have more children's therapeutic communities. In fact, probably for the last few years, we've had more children therapeutic communities than others. 26 adult democratic TCs. This refers to those services in the NHS working with people with personality disorder, but also those services in mental health settings that are using the adult democratic therapeutic community model, pretty much that's described in the book that Steve and Rex are launching today. And then we have 4 addiction therapeutic communities and 16 communities within the prison service. Okay, so I just wanted to go back to the first cycle to sort of show you. In 2002-2003, we had 38 members. There's a little bit of a distribution. It might be a bit difficult to see, actually, but the vast majority were in the UK. We had one in Northern Ireland. We had a couple in Northern Ireland. But Greece was there right at the very beginning. So, you know, that's what's made the map so small, because we had to get Athens in there. And so 2002-2003, the first annual cycle, we had 38 members. And in this last cycle, we had 80 members, and they were representative of a wide range of services. We've developed an associate membership, And that associate membership enables services from all over the world to participate in the community of communities, and we want to increase the number of those that get involved. And it's a particular type of membership designed for them. And actually one of our, now is it Australia or New Zealand, one of the communities actually have a member on our advisory group. It's New Zealand. So one of the addiction therapeutic communities in New Zealand, their leader is on the advisory group. So we hope that they will help us to develop this model further. So I'm going to just talk a little bit about community of communities achievements against the standards. But I want to just sort of say a little bit of something, a sort of a proviso really, before we go ahead. So just to bear in mind that our annual cycle ends on the 31st of March, so tomorrow. And then the new cycle starts on Saturday, the 1st of April. So at the moment, we haven't done a complete analysis of all the data we've collected. When I say data, when you have your visit and when you do your self-reviews, you say whether you meet or don't meet a standard and such like. And so we collate all of that. We put that together. And we have, so the data that I'm presenting today is based on a kind of initial analysis, just some initial thoughts. We also have had the forum earlier, which has made that sort of quite difficult for us to sort of get all the correct data at this time. And just to bear in mind that the data that I'm referring to in relation to 2016-17 is based on 61 visits. We did 61 visits in total, and the data is both self and peer review data. We will be publishing an annual report at the end of May, so there'll be a much more detailed work in there. So there are 5 sections in our standards. We have the core standards section, which is the section which is very much about those things that need to be in place in order to be a therapeutic community. And then the other sections are about supporting that work and improving that work. So there's a section on staff, section on joining and leaving, section on therapeutic framework, and a section on external relations. So I'm just going to show you a few bits and pieces. So I hope you can see this. This is a difficult, it was difficult for me to show this because we really needed the standards up there for you to see it. But I just want you to see, this is the data from 2014, 2015, 2015, 2016, and 2016, 2017, the last 3 cycles. And you can see quite a lot of improvement has taken place over that period of time. This is based on around 32 services that are the same services over that 3-year period. Because, of course, with our annual cycle, there is some services don't get reviewed every year, and some services have interim years and such like. So there's definitely an improvement, quite a marked improvement in terms of the core standards 1 and 2, which is around having therapeutic community, a clear therapeutic community model. And I think that very often this was something that some services sort of struggled with articulating what it is that they were doing, and for staff and residents to be able to communicate that. And that's shown a real clear difference, an improvement sort of year on year. What's also been a clear difference, and something that we actually sort of focused on quite a lot over the last couple of years, is about community members being aware of expectations of community members. So in some services, actually helping people to communicate right at the very beginning that it is expected of you that you will, this is what a therapeutic community expects, this is what you can imagine will happen. And I could point out, I could pick up a number of other issues in there. There's another one that is quite a distinct change, which is CS5. CS5 is the standard around having structured timetables of activities that reflects the needs of the members. I think one of the reasons why this standard was a difficult standard for people was because often services had a structured timetable, but they didn't necessarily review that timetable in the light of the residents that they had at the time. It was like, this is the timetable we've always done, rather than thinking, actually, is this, art therapy group now, something that we need to be doing, or should be doing, or should we perhaps have something different? So just a couple of other notes from the data. We have improvements overall in relation to some of the staff standards, but there's been a struggle with others. So again, as I say, the staff selection process, so I think the core competency framework has been really helpful. It's really, over the last year, we've noticed people using it a lot more during the recruitment process, putting it into job specifications and such like. So that's demonstrated there as an improvement. There's been quite a struggle with having sufficient staff to run the programme, and I guess that doesn't come as any surprise to a lot of people here that there is sort of cutbacks in relation to staffing, and there's a kind of downturn, not significant, not hugely significant at the moment, but it's a worrying trend that we need to be thinking about, and communities need to be mindful of. One of the areas where we really focused our attention with services was around group supervision. We don't have a standard around individual supervision. This is because most of the regulatory frameworks that you're all sort of embedded into your service, or your service is embedded into, actually has individual supervision as a requirement. So it's just something you have to do as part of the work. So what we wanted to do was to focus on the important elements such as group supervision and reflective practice groups. So if you look at the standards, the second column along and the final column along, you'll see, the last two columns demonstrate some improvement in those areas, that there is more group supervision taking place, and definitely groups where things like staff dynamics. And again, sometimes it was a question of language. Sometimes it was a question people did have staff dynamics or staff process groups or reflective practice groups. They just didn't have them, they didn't call them that. So it's something about that. And finally, just to quickly look at some therapeutic framework standards where there was quite a shift. 4.2 lesser so, the sort of structure of meetings to... I think I'll focus on the final one, which is the 4.5, which is one around risk. This is quite a concern. And I think that the significant decrease in performance in relation to this standard, and these are standards that are met, and this was around the therapeutic community has an approach to risk that supports members to test new ways of thinking and doing. And I think, given the anecdotal evidence that we've had, is that there has been quite a, it's been quite difficult for people to have a positive attitude to risk within a very risk-averse environment. And increasingly, services are finding it problematic to try and, have a much freer and much more open attitude to limits and permissiveness. So it's something perhaps we might need to be thinking about. So in terms of Footsteps to Futures, we do have them in the room. They're doing a presentation for us, but they have given us permission to show us their data, which is really impressive. So I think you'll all agree that if we look at the community's performance, which in last year, the 2015-16, which is in the middle, what we've done is that the first column is the comparison against the rest of the network. So the average community of communities standards met, partly met is in orange, and grey at the top there is not met. You'll see that Footsteps for Futures were on the journey. They were beginning their journey. And they were quite significantly below the overall average. But look at them this year, flying high, and in terms of meeting over 90% of all of the standards for Community of Communities. And they're going to be talking about their journey in a presentation this afternoon. And I just wanted to point out some specific areas where there really was an improvement in terms of core standards. You can see went from 56% to 97% met standards. The staff standards from 18% to 82%, and therapeutic framework from 53% to 89%. And I think specifically we pulled out the therapeutic community model of practice, articulating what their therapeutic community model meant to them. And again, the community members are aware of expectations. These are the issues that we pulled out at the very beginning. And then the therapeutic program being overseen by an appropriately qualified leadership. So I think that there's been really quite a move towards quite a tremendous improvement. So if you want to know how they did it, they're doing a workshop. So I just wanted to finish by saying something about the aims that we identified in 2002. So when we first started the Community of Communities 15 years ago, the whole aim of the process was to provide a distinctly TC framework for quality improvement. A cost-effective and time-efficient system of quality and improvement, a systematic forum for exchange, regularly revised and agreed service standards, and a body to influence statutory regulation. We maintain those objectives. We maintain that those are our aims. I think we've been successful in some of them rather than others. I think the final one, body to influence statutory regulation, is a work ongoing, and it is a very difficult area to influence. However, that doesn't mean to say that we shouldn't be trying. And if I think about the challenges for Community of Communities in 2017, 2018, I think maintaining the integrity of a TC framework for quality improvement is absolutely top of that list. I know that for many of you here, graphs and stats and such like isn't really very TC, but it is those stats and graphs that can enable us to do the influencing of regulatory and statutory bodies. So we have to have both. And we have to maintain the integrity of TC framework within the context of scoring and graphic representations of performance. But I'd like to think that that work takes place here on your behalf, and that we can support you to do that whilst you continue to do the work that you do, and that the visits are places that are helpful in terms of sharing learning from one another. The other challenge for Community of Communities is responding to the new TC landscape that I described earlier. There are struggles in the NHS and social care, but then I stood here 10, 12 years ago saying the same things, and we're still here, and we've got a growing membership. But there are challenges. There's growth in the therapeutic childcare setting, which we're looking at and working towards developing specific standards for therapeutic childcare, which are not about being a therapeutic community, but about operationalising some of the therapeutic community core standards and core principles in different ways. And the adaptation and diversification of TCs. There's a lot of different types of TCs out there. We've heard the faith community. We've got green care, there is SLOW. I think it's going to become a therapeutic community as a whole, from what I understand. But there's lots of work going on there, and we as Community of Communities need to keep up to date with all of that. We also need to ensure that members' scarce resources are utilised most effectively. We know that some of you go on reviews and don't always find them as helpful. We know that some of you receive reviews that are not always as helpful as they might be. We need to ensure that that doesn't happen, and that you give us feedback and we respond to that feedback by ensuring that we do our best to respond to your requirements. So we need to increase learning opportunities and the value of process. I do believe that peer review training is part of that, and being very clear about the standards and the knowledge of the standards would help, I think, enormously with that. So it's something we're going to be working on. We do need to enable closer links with statutory regulations. As part of the CCQI, the Royal College of Psychiatrists Quality Improvement, Centre for Quality Improvement, we are very tightly linked into CQC. And so what we need to do is to ensure that the data gets out into the realm, so that when you're visited by your CQC inspector, if you're social care and NHS, they know about you, and you're there, you're on the list as a service that are participating in one of the quality networks here. We need to do the same thing for Ofsted and other regulators too. We're very tied in within the prison service, and I certainly think that's something that we can replicate. And we need to promote the value of membership to managers and commissioners and key stakeholders. We need to help you communicate what it means to be part of this network. And I'll leave you with something a commissioner once said to me. And he said that if I know that a service is participating in a network like this, if I know that they're participating in shared learning with others, and that they are, even if they're not performing, at a high level, as long as they are participating in it, they're sharing learning with others, they're open to learning from one another, then that makes me want to commission them more. And so it's not all about performance targets. It's not all about specific percentages. It's also just about communicating that you are part of the community of communities and what that community of communities does for your service, and demonstrate that you are open to learning. So I'm going to leave it there with a couple of minutes for questions.